So it's not only important to know how to build terms, it's also important to know how to break them apart, so that if you see a term that you're not familiar with, that you're able to figure out what it means. So in trying to figure out a term, first thing you want to do is define the suffix, and then the prefix if it has one, and then the root word. So here's an example. If we had the word dysuria, and you wanted to know what that word meant, you would break it down into its parts. So dys, ur, and ia. So looking at the suffix first, the ia means a condition of. So we're talking about some sort of condition of something. Looking at the prefix next, dys indicates difficult, painful, or abnormal. So now we're looking at something that is difficult, painful, or abnormal as a condition of. And then we look at the root word, which is ur, which indicates urine. So from this word, by breaking it down, we find that dysuria is painful urination or difficulty urination. And other words are broken down in the same manner. So let's talk about abbreviations and symbols. Abbreviations and symbols take the place of words to shorten notes and documentation. However, it is extremely important that you don't create your own abbreviations or symbols. Abbreviations and symbols must be standard medical abbreviations. And there are lists of standard medical abbreviations. Many healthcare organizations, especially hospitals, have an approved list of abbreviations. For patient safety reasons, most healthcare organizations also have a do not use abbreviations list. These are abbreviations that look alike or sound alike other abbreviations. Misunderstanding of these abbreviations can cause fatal medical errors. So let's look at some medical terminology related to pharmacology. We will specifically talk about these in more detail and more explanation when we get to pharmacology, but there are specific medical terms that are used when related to pharmacology. So pharmacology has its own terminology. There are prefixes commonly used in medication administration. Metric conversions used in drug calculations are also used, and we'll learn metric conversions in detail during pharmacology. There's also medical abbreviations associated with pharmacology. So as an example, the next couple of slides have tables from a paramedic textbook because remember at the textbooks have not been updated to include the newest scope of practice. So we're taking some of this information from paramedic textbooks. So the first table, which is indicated here, is table 7-12, indicates prefixes commonly used in medication administration. So you see the prefix name, prefix symbol, and then the prefix value. The value at this point isn't that important. We will learn those as we get into pharmacology, and we won't learn all of these, but we'll learn a lot of them. So the first is micro, which its prefix is MC, and it indicates 1/1,000,000th of something. The next one is milli, which its prefix is an M. It indicates 1,000th of something. Centi is indicated by a C, and it indicates 10 of something. Kilo, or K, small k. Notice these are small, so far small letters. They're lowercase. Kilo indicates 1,000 of something. And mega, which uses a capital M as opposed to a lowercase m, is 1,000,000 of something. So looking over at the table on the right, table 7-13, we see some metric conversions. Again, we will get to these in detail during pharmacology, but it's important that you at least go ahead and familiarize yourself with the terms. So weight is, in the metric system, weight is indicated, the unit of measure is a gram. Okay? So 1 gram is the unit of measure. So a kilogram, which is on the top line, indicates that it is 1,000 grams. It's 1,000 of something. So again, looking over at the prefixes we used that we just went through, so a kilogram is 1,000 grams, or its conversion is about 2.2 pounds. That's going to be an important conversion that you learn. And then we have the 1 gram, which is 1,000 milligrams. And then we have 1 milligram, which is 1,000 micrograms, or 1,000th of a gram. Looking at volume, the liter is the unit of measure. It is equal to 1,000 milliliters. And notice how milliliter is written. You have the small m and the large L indicating the liter. Temperature, in most things with, and especially within EMS and the emergency departments, things still are using the English system, which is the Fahrenheit system, but you should still be somewhat familiar with the metric conversion. So as what we consider a normal temperature, which really isn't normal for everybody, 98.6, is about 37 degrees Celsius. And then as we look at length, we see 1 centimeter is equal to 10 millimeters, or about 0.39 inches, and 100 centimeters is equal to a meter. So, and when we're measuring length, the meter is the unit of measure there. So we will go into these in more detail and learn conversions for them when we get into pharmacology. So this table indicates, and I'm not going to go line by line through this, but this table indicates some medical abbreviations that are associated with pharmacology. So you can see there it starts with AMP, which we sometimes refer to as ampule. The fourth line down, you can see GTT, which we use to indicate drops. We use this a lot of times with IV drip rates. So there is an element of IV maintenance in the EMT curriculum, so you will learn that abbreviation as well. As we move on down, you see IVP, which indicates intravenous push, which would be for a medication. As we move on down, we see KO, which means keep open, or below that is KVO, which indicates keep vein open. And then below that, you see lactated ringers. Can be indicated by two different abbreviations, LR meaning lactated ringers, or on the other side, the other column over there, you see with RL with ringers lactate. So those are the same thing. So moving over to the right-handed column, we see MDI in the second row there, which indicates a metered dose inhaler. So that might be something you will use. Again, you see RL as ringers lactate. You will see sometimes SVN as small volume nebulizer. Not so much anymore, but you sometimes will see TID, meaning 3 times a day. TKO will be used for indicating to keep vein open. So KVO, TKO are exactly the same thing. It's just two different ways to say it. So your textbook has tables of common root words, combining forms, prefixes, suffixes, and abbreviations for you to work on learning. So it's important that you go through those and you begin to learn those. These lists are not exhaustive, so that's important to know. This is not all of the root words, combining forms, prefixes, suffixes, and abbreviations that exist. Others do exist. It's important that you're able to figure out what medical terms mean. And if you have any questions, bring them to class with you.